connecting you to the people that shape the communities and neighborhoods of Kansas City. This is Time Warner Cable Newsmakers.
Hello and welcome to Newsmakers. I'm your host, Nancy Lewis. We're here today in the Negro Leagues Baseball Museum with Joe Connor, who's the director of the Wyandotte County Health Department. And let's start out by talking about Healthy Communities Wyandotte. It is a big program.
It's a big program. It took a broad look at our community health, and it was based on a very poor health ranking that our county received in 2009. And so we looked at all the different areas that affect our community health and come up with some strategies and some and got community input on the importance of those strategies.
So it had this rating that was poor as far as the health goes, and so you guys decided we're not going to ignore this, we're not going to pretend it's going away, we've got to figure out what to do to change that. Yeah,
our mayor, Mayor Reardon, convened community leaders to start talking about these issues and made it one of his platform, a member or a portion of his platform that he wants to achieve improvement in these areas.
This program has legs. It seems to get into almost everything that goes on in the county. Streets, for instance.
It does, and I think that there's a couple things that do with infrastructure. One is you want to provide an active living opportunity for our residents, and that means that they have the ability to walk, they have the ability to ride their bike, or access to a trail. The other part of it is that it has to make sense. And so these sidewalks and trails have to go to somewhere. Right. And so for a lot of our urban community, of the inner city part where the housing is really dense, there's opportunities to walk to the grocery store, to the libraries, to the convenience stores, to wherever, if it's planned correctly. And so that's what we mean by healthy infrastructure.
There's that. It also gets into nutrition. I know there's a nutrition action team that is working on some expansion in urban neighborhoods. Tell me about that.
What we're trying to do with the Nutrition Action Team is to get people more access to healthy food and also teach them about healthy food. You can buy less expensive healthy food. It's not always more expensive than what you can get prepackaged. And they're also looking at community gardens. An offshoot of our initial work was to work with our Board of Public Utilities to get access to water to people that wanted to start their own community gardens on vacant lots and other things. And so the work is starting to trickle down into the real neighborhood level, and we're starting to see some impact.
I know that you received a $100,000 grant from the Robert Wood Johnson Foundation. Tell me about how you got that grant and how that money will be used.
Yeah, Robert Wood Johnson Foundation actually funds the National County Health Rankings. That's one of their signature projects. So they're looking for communities that are actually doing something with that report, and our name kind of came up on their list. And so they made a video about our community. It was very well done and represented both sides of the issue very well. And so then it was kind of what's next. And so we said, you know, we want to continue our community engagement, but we don't have the staffing for it or the funds. And so they came up with this learning laboratory and approached us with this partnership with Robert Wood Johnson, with the University of Wisconsin, their Population Health Institute, and then our Healthy Communities Wyandotte. So we just started to engage kind of our three-pronged partnership, and they're going to learn from us and we're going to learn from them. So we hope to build capacity at the national level with our work.
If I'm somebody and I live in Wyandotte County and I want more information and I want to know how I can get involved in all this, how do I do that?
There's a couple different ways. You can certainly call the Health Department. You can call my office and we'll get you information. We also have a Facebook page, and we also have a website. So we're trying to be redundant with our communications and try to meet everybody's needs.
All right, well, good luck with the program. Thanks a lot.
Thank you very much.
Thanks for being here, and thank you for being here, and we hope to see you next time on Newsmakers.